For dental practice managers, content is more than advertising. It's a tool for patient care and growth. But what if your best content starts not with teeth, but with the heart? The health link is undeniable. This isn't a small issue. You're fighting the most common disease on the planet, untreated tooth decay. And for adults, the problem is widespread. More than half are dealing with some form of gum disease right now. Here, we'll show you how to turn these critical health facts into content that attracts and retains patients for life. The bridge between patient anxiety and patient action is trust. Educational content is the foundation for building it. Your patients are already searching for answers about sensitivity, bad breath, and insurance. Meet them there. This guidance is vital because the body's hardest substance, tooth enamel, cannot regenerate. Prevention is the only option. The motivation for patients also goes past physical health. A huge 92% of adults believe a healthy smile boosts their confidence. Patients no longer want a transactional relationship. They are actively seeking a personal connection and custom advice. So we know the stakes are high and patients want a connection, but how do you create content that actually forges that bond? The mechanism is authenticity. Patients can spot a sales pitch from a mile away. So what is the best format for showing genuine care? The answer is storytelling. Genuine patient narratives bypass skepticism, letting a potential patient see their own success. Before and after photos aren't about vanity. They are a visual contract of your promise, showing efficacy that words never can. This human connection extends to your team. Introducing staff transforms strangers into familiar faces, which reduces patient anxiety. Another powerful trust mechanism is clarification. When you correct common dental myths, you become the definitive source for truth. So, what does this look like in practice? Let's look at 3 content pillars you can implement tomorrow. First, use video. It's not optional. Use it for procedure demos, oral health tips, and team introductions. And most importantly, use video for patient testimonials. This is the format we asked about, delivering authenticity like no other. Second, make your content interactive. Quizzes or cost calculators don't just engage, they provide valuable data on patient needs. Third, anchor your content locally. Share your community involvement or sponsor a local team. This builds trust at a community level. A plan combining video, interactive tools, and local stories creates a powerful, multi-pronged approach to patient engagement. But the most successful practices go even deeper. They create content that addresses the hidden factors affecting oral health. For example, discuss the impact of chronic stress. Educate patients on how teeth grinding can cause significant damage. Go past just sugar when talking about diet. Explain how acidic foods and drinks, like citrus or soda, can erode enamel just as badly. This wider perspective repositions your practice. You're no longer just treating teeth, you're a partner in their overall well-being. So how do we tie all of this together? How does an article about stress connect back to practice growth and patient retention? Here's the connection. Recall the link between oral health and heart disease. Content on stress or diet is preventive systemic care. Now, combine that with the power of testimonials. Imagine a patient video where they discuss how your advice saved their teeth. This synthesis of deep health education and authentic human stories is the goal. It makes your practice an indispensable healthcare partner. And indispensable partners are never replaced. This is how content directly translates into lifelong patient retention. So, effective and engaging content is not a nice-to-have. It is a fundamental function of modern patient care and practice management. We've seen the high stakes, understood the patient mindset, and laid out the content methods that build unbreakable trust. Your call to action is to audit your content calendar. Are you just talking about brushing, or are you addressing whole body health? Start creating content that matters, because when you improve your patient's knowledge, you improve their health and your practices.